our official clock, which Steve fixed for us last week.
New battery?
We got a new battery,
All right.
so
I'm
I
ready,
think we're cooking.
Okay,
All right, I'll call the meeting to order. Are you ready, Corey?
I'm ready.
Okay, if you'd stand with me, we'll say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay.
You know,
As we look at the agenda, we have time for public comment.
still
Don't know that we have any public comment. So we'll move on. Any amendments to today's agenda? No one has any amendments to the agenda? All right. Then we will take a look at the January 19 board minutes.
Madam Chair, if I may, I'd move the agenda as printed.
Okay,
Second that?
I'll second that. All right, we have minutes here. Okay. All those in favor, say aye.
Aye.
Opposed? And the minutes have been approved. All right.
That was,
No.
Madam Chair, that was the agenda. I was
Oh.
approving the agenda. I'm sorry.
Oh, the agenda, okay.
I move the minutes from the January 19th be approved as printed.
All right. Do I hear a second?
I second that motion, Madam
Second
Chair.
that one. Thank you. Okay. So all those in favor of the board minutes being approved, say aye.
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 Opposed? Those are approved. Thank you. All right, then we move on to the second item, and I believe that's Diane.
Good morning.
Good
Diane
morning.
Winter from Public Health. I have one item for your consideration this morning, and that's to approve hiring Abby Wright, Public Health Nurse, full-time, level C41, step 2, effective February 16th. And Abby is being hired to fill the position that will be created by Eileen Nelson's retirement at the end of March. So I was here in the fall and asked to fill that position prior to her leaving. We've been a little challenged to fill it. This is our third round, but we were successful in recruiting Abby.
I'll make a motion to hire Abby. What was the last name? Nelson,
Right.
right?
Abby Wright.
Oh, there it is. For, public health nurse.
I will second that motion.
All right, we have a motion to hire Abby. Now, do we ask for any discussion on that at this point?
Yes.
Anyone have any questions? I was wondering, is this a non-union or union,
Non-union.
non-union position? All right. Any other discussion or questions? Okay, all those in favor of hiring Nurse Abby Wright, say aye.
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 Those opposed? Motion carries. All right. Next.
I'll try and do a COVID update, but I'll tell you that, I'll try to make it organized, but it's kind of swimming in my head, so if I confuse you or have questions, please let me know. But
Diane, you've been able to track this for 10 months.
Oh,
Whatever you,
I
what,
won't tell you what I did yesterday. If I told you what I did yesterday, you would probably send me home.
you've done well, is all I'm
Oh,
trying
my
to say.
goodness.
So this is where we're at. So we're almost to a year. It was March 6th of 2020 when we had a meeting in Glencoe between the three counties and the emergency management and public health, just kind of anticipating what was coming, and then it just kind of came very quickly after that. So it's hard to believe that we are almost into it a year. A little bit of data. First of all, Minnesota positivity rate has been on a steady decline, and it's been under 5% now for quite a while. The current test positivity rate for the day yesterday was 3.39%. And then if you look at the 7-day positivity rate, which is typically used by the governor and others in making decisions about how to change what we're doing or not change what we're doing, that's been consistently around 3.7%, and that's one of the lowest in the country. So obviously, what we're doing is making an impact. You probably have heard about the variant strains of COVID that have surfaced in some of the other countries. Now that there are 8 cases of the variant discovered in the UK that have been diagnosed in Minnesota. And then 2, the second one, the Brazilian, I believe there's just 1 case confirmed in Minnesota. We don't know a lot about those variants other than they seem to spread really rapidly, don't necessarily cause any more serious illness. And at this point, the vaccine appears to be effective against them. So obviously, they'll be keeping an eye on that. And there's also a 3rd variant, I believe out of Africa, but I don't believe it's been diagnosed here in the Minnesota as of yet. Locally, as of yesterday, we had 1,997 confirmed and 31 probable cases for a total of 2,029. I anticipate 1 additional case will be reported today, and it's really nice just to see 1 or 2 on that line list. I mean, in November going into December, we were seeing upwards of 50 and 60, and it was just very challenging to be seeing those number of cases and then doing the contact tracing case investigation around that. We have had 33 deaths, 28 of those were in long-term care, 94 hospitalizations, and 19 ICU admissions to date. So again, like I said, I anticipate 1 additional case to be added to the list today, but it certainly has leveled off and gotten to a much more manageable amount of positives. All of the skilled nursing facilities and assisted living facilities in the county have received at least their first dose. That would include residents and staff. I think Dassel may be actually receiving their 2nd dose this week. I know that there was 1 facility that was vaccinated right after the first, and I believe it was Dassel. So we are on target to have all assisted living and skilled nursing facilities vaccinated with both doses by the end of February. Contact tracing case investigations. So we hired a part-time position just specific for that work late last summer. And she has been doing just an excellent job, like I have mentioned before. With the decrease in cases, we've been utilizing her in our clinic, which has been an asset because we have had some staff out, so staffing has been a little bit of a challenge. And we will continue to do that. I know the latest was you've approved her through the end of March. So depending on how things move from here on, I may come back and ask to extend that. We're seeing fewer essential services requests just because we're seeing fewer positives. I may talk about communications, but I think I'll jump to vaccinations because that's what everyone is most interested in, and that's probably what is the most important to talk about right now. So with vaccinations, so the state received a little bit of a bump this week, about 10,000 more doses. So a lot of that was being sent to the pilot sites that you might have heard about. There were pilot sites identified for the community, and then there was these pilots that were identified for schools. So some counties got additional dosages just to start administering vaccine to the schools. Fortunately, Meeker was not chosen to be one of those. The Big 9, which is now the Big 10 health systems, are also getting direct shipments of vaccines, so you'll see more and more about that. If you're wanting to know where you can get vaccine, there's an interactive map on the MDH website. If you just go to MDH and search vaccine, it should pop up. If you have trouble, let me know and I'll send you the link. I think let me tell you where we're at, what we've done. So in Meeker County so far, there have been 1,659 individuals with at least 1 dose. So that includes the hospital staff that have been vaccinated, the residents and staff of skilled nursing facility and assisted living facilities that were vaccinated through the pharmacy program, and then the phase 1A priority groups, which local public health has been focusing on. So we have vaccinated to date 439, so that means we found 9 extra doses. We have been focusing on emergency medical services, community vaccinators, which are typically pharmacists, local public health staff who are vaccinating. We did vaccinate staff and residents of 3 assisted living facilities, And last week, we were very focused on residents and staff of group homes, and then just some other healthcare workers like dentists, chiropractors, optometrists, PCAs, home care, anybody working in the healthcare field. We thought we were done. And then last week, MDH posted an interactive site where if you were a healthcare worker and you hadn't been contacted by your employer about how to get vaccinated, you could register with MDH and they would push it out to the counties. So on Thursday, we got a list of 70 additional individuals that we're calling and trying to make contact with right now that we will be vaccinating tonight with our last 70 doses. We have 70 first doses on hand for first dose clinics this week. We also have second dose clinics scheduled tomorrow and Thursday. Our clinics have been in the Family Services building back into what was the old cafeteria band room, and it has worked out really, really well. It's scalable. Right now, we are just using about half of it. We can easily move into the other half and scale up to a larger population. It has good flow, and we've been able to increase our throughput, or the number of individuals that we're pushing through with every clinic. We're identifying different ways to be more efficient as we move through. They're instructed to enter through that south door, and that's handicapped accessible. They can also enter through the front door, which is handicapped accessible. But I think the biggest bonus for us is that it's close to our immunization clinic, so our immunization refrigerator freezer is right there. So there's less chance of there being any sort of default with that vaccine where it would either have to be destroyed or would be unusable for any reason. We don't have to take down. We can leave our setup up. Maintenance has been awesome. They've been cleaning for us afterwards, so we don't have to stay late and clean. And then just access to our staff is making a big difference. So we hope to continue to use that site as long as the space is adequate. If we get to a mass clinic site, we've got locations identified in Litchfield and other communities, but our hope right now is to stay with the Family Services building. We've had great support. In addition to using some volunteers, we've also been able to use the ones supporting hand nurse and also emergency management. The Sheriff's Department have been excellent. We have even had the community paramedic on site just for that observation piece. So it's really been a great partnership, and I super appreciate all of their support because it's been a lot of moving pieces, but they've really all come together. So most recently, you would have heard the statewide goal of 90% of vaccine in arms within 72 hours of receipt and 100% within 7 days. And MDH and the governor's office will be posting dashboards. I believe they're going to be released today, and it will have local public health county level data, so it'll have specific Meeker County data. That's kind of disappointing. I'll tell you that we're probably going to be around 64%. Not disappointing in the way that we vaccinated, but the change happened after we had already set up all of our clinics, made our appointments, and it's really hard to pivot into 72 hours when you're vaccinating group homes and assisted living facilities because they're kind of on their schedule. So we've completely pivoted. We will be within compliance when we get our new vaccine next week, but I was a little disappointed when I heard that information and saw that data. So where are we? I think I talked a little bit about first and second dose clinics. We've really not had any issues with reactions. We've had a couple reactions. Some were delayed. We have 2 individuals that will not be receiving their second dose. They've been in contact with their medical provider, which is fairly typical of what I've been hearing from around the state. I think the biggest challenge right now is just not knowing when the vaccine is coming, and we didn't get vaccine this week because we spent most of last week trying to clarify with MDH because there was a discrepancy in what they had as our allocation and what we had as our allocation. And they were claiming that we had more second doses than first doses, and I wasn't going to start going down that path because you want to have your first doses and second doses be equal, and they were not. So we'll be finishing up, like I said, with the first vaccines tonight, and then moving into school and childcare personnel with our next allocation, which I anticipate next week. So that's kind of where we are in a nutshell, but I'm sure that created a lot of questions.
So, Madam Chairman.
Yes.
Diane, first of all, thank you and thank your staff for all your hard work. I'm proud of what you're doing. I'm gonna go back a little bit here. I didn't quite understand what the state changed. Can you explain that a little bit?
So as the vaccine was rolling out, right around Christmas, New Year's, our direction, and the Minnesota vaccine plan was to vaccinate phase 1A. So that included healthcare workers, hospital staff, long-term care assisted living, emergency medical services, and then any other healthcare worker that wouldn't be associated with a hospital or long-term care. And the goal was to have them all vaccinated by January 31st. So we set out our calendar, scheduled out all of our appointments in our clinics based on being done as of last Thursday, which we thought we were going to be. But then apparently the state, the governor's office, and MDH was getting pressure because other states were apparently administering faster. So rather than just completing 1A by the end of the month, they changed it to being 72 hours after receipt of vaccine. Well, we just couldn't pivot that fast.
Sure.
I mean, so we stuck to our plan, but we've amended our plan so that moving forward, we can meet that 72 hours.
So when they see the dashboard, there's gonna be some questions, probably.
Yeah, and it's not gonna look very nice. I mean,
That's what-
64% doesn't look very good.
No, and I get it. Another question I've been getting is, I had a couple constituents call, why can't we get the vaccine? I called and I can go to Wilmer and get it. And I said, well, you know, are they at one of the sites? Are they going through MDH? They're saying no. My guess is the bigger, like Centric Care is getting it and they're pushing it out to Caris or whoever. Is that true? Is that right?
Yes, I think it was, I'm sorry, you were gonna say
No,
something.
go ahead.
I think it was 2 weeks ago on a Friday on our Regional Healthcare Coalition call. While we were having that meeting, the leader of that, Eric Willer, received a phone call from the state and he came off that call. And if you know Eric, it takes a lot to shake him up. He was pretty shaken up because he had just received word that the state was choosing to push out vaccine to the Big Nine. And they were working with the Minnesota Hospital Association to push that vaccine out. So what that meant was that there was less vaccine to come out to local public health. And I think the bigger issue is not that we don't want them to vaccinate, but we have a plan. We've had a plan, and now the plan changes at a minimum every week. Sometimes it changes more often than that. So that was a big change in the plan. All of a sudden, vaccine was being pushed out to healthcare systems. Not everybody, because Meeker Memorial didn't get anything. If you were a small or mid-sized healthcare system, you maybe got something, but not necessarily. So there were all these inequalities that were set up based on what healthcare system you go to, where you lived, and we didn't even know. We heard that Wilmer was vaccinating and St. Cloud was vaccinating, and we didn't know where to tell people to go because we didn't have the information.
I know people, classmates of mine from Granite Falls were getting vaccinated in St. Cloud. I think they maybe made an appointment through MDH. Then other people call and say, well, you know, I called, but I can't get an appointment because so that didn't work. So I think people need to understand that the problem hasn't necessarily been on our end. I think MDH or whoever, it doesn't matter where the blame lies, but somebody dropped the ball here and they keep changing how they're doing it, if I'm saying that right. And that puts us in a very, very bad position. So I appreciate all your hard work. The second thing I've heard is the second dose is harder, and I don't know if you know this, that there's more reactions to the second dose than the first. Is that true, or?
Well, we've been hearing that.
Okay, but we
If you
don't,
wanna call me tomorrow, I can let you know, cause I'm
Okay.
getting my second dose today.
so,
So, yeah, we've been hearing that, so we're trying to kind of plan for that this week, knowing that our local public health vaccinators are getting their second dose today. How are we gonna staff clinics if we have staff that need to be out?
my dad is 93, and he had it at the VA, and he was fine, but now he's all worried about the second dose, cause he's hearing that. My other question quickly is, I had a supporting hands meeting, yeah, well, you were there. So is 8 hours of a supporting hands nurse enough a week? Cause I was gonna bring that up when Joel mentioned it, and I thought, well, you didn't say anything, is that enough help?
Right now it is.
Okay.
With the clinics that we're doing, because we have her, Dixie, that's working for us, and if you remember, when Kelly left in April, she stayed on casual part-time just to be accessible to her if we needed her during this pandemic. And then Heather Zeal, who left some years ago, she actually is being retained for the purposes of CHS. She works at the hospital, but we need her breastfeeding certification for one of our peer breastfeeding programs, so she's on very casual part-time, and she has agreed to pick up
Good.
hours. And then we've got about 6 retired nurses in the community, and we're working on our volunteer list. So the volunteers have been very helpful so far.
Okay, well, thank you, and thanks again for all your work on this, and thank your staff.
I will, definitely.
Madam Chair. Just a couple of questions. That 33 deaths has stayed for, it's been several weeks now.
Yes, it's been
Yeah.
pretty steady, or steady, stable.
And the hospitalization, the intake has been about that 90 for a while now too, or?
Just had one or two last week. It seems to be a day last week there
I
were.
think it
there
went
was an
up one.
increase, yeah, and we had to adjust the chart, but yeah,
I think what I try to stress, Paul, to people is this is cumulative now, so.
yes.
Some people think we have 90 people in the hospital. No, we do not. So my question always is, when are they gonna start over with the numbers?
On
I didn't mean to
March whatever,
interrupt you.
on March whatever. they-
Yeah, maybe
this
on
many
March,
year.
whatever.
Then is your pharmacy different than the Meeker Memorial?
Yes, so their pharmacy and their vaccine is an entirely different stock. Yes.
Okay,
Yeah.
because I see they are going to have some vaccinations going on this week.
Well, I don't know the details. We were partnering to do a co-located clinic using both of our staff. But they received notice over the weekend that they were getting vaccine, and so I just got an email announcing that they were getting vaccine, but I don't really know the details of their plans, other than I understand it's going to be at Cornerstone, and I heard that through the community, so don't quote me on that.
Well, I also, Paul, I got a call on Saturday, I believe, from Kurt that they were getting, I'm gonna say 700 doses, and they didn't want it too public because they wanted to start with 90 and over and then do compromise. So I suppose, how much time do they have to use it? I mean, there's no time when they tell you you're getting a Monday, I think it was Monday,
Yeah,
and then you're supposed to have a clinic ready, so that's probably why.
I'm sure they're moving fast to get that into arms by that 72-hour benchmark, because the kind of the word on the street is that if you don't get it in within 72 hours, you're going to be held responsible for that. You may not get additional vaccine or reduced
Oh, wow.
amount of
See that
vaccine.
from
So
Kurt.
it's kind of like plan, I don't know.
All right.
Thank you.
Welcome. Other questions?
I just wanna thank you for, I mean, you've been dodging this minefield for close to a year. I mean, we've been on EOC calls since last March, and they started every day, and it's been a challenge all the way through for you to navigate that. And it doesn't appear to be getting any easier, so I just appreciate it. Pass that along to the staff.
Absolutely, from the whole board.
Yes,
We
from the whole
appreciate it.
board.
Well done.
I will certainly extend your appreciation and let them know. Quite honestly, they are fantastic. Couldn't ask for a better staff, but I worry about them. They're putting in evening hours and working extra clinics and trying to flex their time. And we're kind of moving in and out of our COOP plan to make certain that we are managing what we have to do and still vaccinating. So I keep an eye on them, but I worry about them.
Who's keeping an eye on you?
Yeah,
Yes.
exactly. I was gonna say,
Well, I'll tell you, I can tell. I hope it's just COVID, not aging, but I've done some pretty dumb things. Oh, I won't even go into that. Any other questions?
Well, take care of yourself too,
Yeah.
please.
Thank
Done
you.
well. Thank you
Thanks,
so
Diane.
much, Diane. Yep.
Thanks.
Okay, then I think we move on to number 3, and we have Mikkel.
Good morning,
Good morning.
Michelle Johnson, Human Resources Coordinator. The item I have for you today is to approve appointing the county assessor, so that's resolution 2021-03 in the board packet. So, with the Minnesota State Statute 273.052, they have us appoint a county assessor, so that would be Amy Roush. She's starting on Wednesday. And so this would be effective February 10th, 2021 through December 31st, 2024, with the first 12 months being a probationary period.
I'll make a motion to pass resolution 2021-03 to hire Amy Roush. Am I pronouncing it right?
Yeah, but it would be to appoint, since we've already hired her,
Didn't I say to appoint?
hire. So it would be to appoint her.
Okay. Resolution. I just thought that's what I said.
Sorry.
Cal, no.
Okay,
So that's my motion, I guess.
I will second that motion.
all right. Is there any discussion? We have a motion to appoint Amy Roush. Any discussion? There again, is this a union, non-union,
It's a
non-union?
non-union position.
Is this typical to have, I was reading here, it says effective February 10th through December of 2024.
Yep, so when they're appointed, they have certain set terms. So this one has until December 31st of 2024. I called the Minnesota State Department of Revenue and checked with them on this.
There are some positions, the Veteran Service Office is another one. Is that also that many years? I'm not, is that 4 years too,
I
I think?
believe so.
I believe it is.
And I believe, Madam Chair, I think it's on our committee assignments, the terms on some, these positions that
Okay.
are. So it'd be
They're,
something.
they're treated a little differently than
Yeah.
just hiring someone.
I wondered if that
because
was
of the
typical.
position. Yeah.
Okay. All right, any other discussion or questions on the motion to appoint Amy Roush? All those in favor?
Now we're gonna have to
Oop,
do,
oop.
Roll call.
Corey can do a roll
Oh,
call.
this is the one where we do the roll
Would
call.
you like me
Sure.
to do the roll call?
You may.
Okay. Commissioner Oberg,
Yes,
Commissioner Johnson,
Yes.
Commissioner Bredesen,
Yes.
Commissioner Schiefelbein,
Yes.
and Commissioner Schmidt.
Yes. One question, I didn't, is the background been done
Yes.
already?
Yep.
All right.
All right, I believe that was a unanimous passing of that resolution.
she's starting on the 10th, huh? Is that what I saw?
Yeah, I believe that says.
Is she
the
anxious
10th.
to start?
I think so, she's
Good.
pretty excited, yeah.
And Greg, are you anxious to have someone down there?
Yes.
Everything's all good then.
And I ran into her one day at church and she sounds excited to be coming back, so.
She's pretty I mean, I think she's gonna be good. I didn't see her, I listened in on the interview, but she sounds, like she's
She
gonna.
used to come out to the farm and give me the bad news every couple of years.
How did she?
My district, so. I remember.
Well, very good. Anything else, Mikkel?
That's all I have.
Thank you. Very good. Then we move forward. We have Greg. There he is.
Morning, Greg Schultz, Land Use Director.
Good morning.
Today for the Board of Commissioners from January 19th, 2021 Planning Commission meeting, I got one CUP. I also have a 2021 Water Plant Task Force budget recommendation and one new hire for board consideration. First one I'll start out with is the Planning Commission CUP, and that's to approve or deny Next Gen Dairy for CUP number 15534 for parcel number 15004400. The Planning Commission recommended to approve the conditional use permit to operate a Class C feedlot consisting of approximately 1,050 dairy cattle, 200 heifers, and 200 calves for a maximum total of 1,650 animal units located on existing Class B feedlot in the A1 Agricultural Preservation District in that part of the southwest quarter of the northeast quarter of the south half of the northeast quarter of Section 4, Township 121, Range 31, and Nevada Township with the following conditions.
Madam Chair, I'll, make a motion to approve the CUP for Next Gen Dairy.
We have a motion. Do I hear a second?
I'll second that motion, Madam Chair.
I'd like to open it up for any discussion. Have there been meetings held with neighbors, notification of the increase of animal units for this request?
Yeah, they were notified for the January 19th, 2021 meeting. All neighbors within a quarter mile, I believe.
Was there any objections?
There was no objections, no.
I attended the planning and zoning meeting too, and that's just out west of Eden Valley, a mile or so, so I haven't heard any objections. There was nobody at the planning and zoning meeting. And further detail, Greg can go into it, but they had to apply there, cause they're going to was it Class B to Class A? Or the other?
Class C to Class,
B, they're changing the classification, so they need to, the MPCA trumps, now they're in a different, the
Okay.
state will have to approve it, so they had all them in place for about a year already, or a little over a year, so they've done all the back work.
So the homework is done, the required
I's are
certifications and
dotted, T's are crossed.
approvals are done, and neighbors have been,
yeah. And they had a variance-
Notified.
They had a variance granted in 2018 to be within a mile of the city limits of Eden Valley. That was approved in 18 for this many animal units, for 1,650 animal units.
That was already
They've
done.
upgraded their manure handling systems and stuff over the last year or so already to meet a bigger threshold, so they've been in this process for, they've got the horse well ahead of the cart.
So is this, excuse me, is this the final step then, or does the state still have to prove it?
I,
The state has approved all their steps.
It's all, so this is it,
Yep.
yeah,
Yep.
yeah.
This is the final step.
and there are no concerns with increasing it that much?
No, they do a good job, they've done a good job, been a good neighbor to the community there.
Very good.
is there any further discussion or questions here for Greg? And I believe we can vote on this with a voice vote.
Correct.
All those in favor say aye.
Aye.
Alright,
All those opposed? Motion carries. All right, Greg?
The second item I have is an agenda to approve a United Water Plan Task Force 2021 budget. I think you all got letters on that.
I'd like to make a motion that we approve 33,760 and amend your proposal that you have given us on item number 8 and bring that back to the $4,000 that was not their original request. However, with the amount of work that's being done there, this needs to be approved.
so run that by me one more time.
Yeah, me
Yep.
too.
Commissioner Johnson.
Okay, Greg is,
I'm following you, but I just
okay,
opened it up.
Greg is making put forth a plan that called for $32,000.
Correct.
Of which, item number 8 above that, if you have it open, the 2240 for the Froning project, they had originally requested $5,000. This is a project that is very, very large in scope, correct?
Yes.
Very large. They have partnered with the DNR for part of the money, but they still have a significant amount of money out of pocket. Bell Lake, an active lake, it's another one of our great lakes in this area that's being utilized by a lot of people in Meeker County. So that is why I'm asking to increase item number 8 back so that they are at the $4,000, which puts it $1,760 over the 32.
So then here's my question. Washington asked for 5,000, got 4. Star asked, I mean, if we're gonna start that, then are we gonna go down? Is this something you're recommending, or?
Well, I've recently taken this over from Paul that had this on his tasking list, the administrator used to do this. And what I've noticed is that technically we have $32,000 a year to spend. That's what it's been. Over the past years, we've spent anywhere from 31, 32, this year will be 35,000 up to 26,000, although the board has recommended anywhere from 48,000 in 2020 to 35,000 in 2019, 38,000 in 2017, and 35,000 in 16 they recommended. What happens, these projects, is they don't all get completed, due to budgets.
Well, who picks and chooses this to start
This
with?
is that water plan task force. that does
Right,
that.
so
So
that, this is my concern, if we start,
Danny and I.
so this was your recommendation to start with, and now it's, I mean,
Well,
that's my concern, because in all the years we've done this, we've never changed what comes, and I'm not saying we shouldn't, I'm just wondering. the
What
thinking.
you got here though is Greg is actually trying to put it on the actual costs that's gonna be out of the county. In the past, Paul basically had a little, actually suggested to the board to have a higher budget for each time. So actually it's gonna actually save us, it's gonna save us some budget money because this is gonna be kind of the cost that's gonna be out. Where like last year was budgeted for 48,000. So
Well, what is it
Actu-
budgeted for this year? I don't know why I'm so lost here.
32 is what he's recommending, I'm asking for 33,760.
And is that what's budgeted, 33,760?
32,000. What we have for.
So you wanna
our
go over
grants.
budget then?
Well, that's part of the issue. I mean,
It is for me.
it is so
It's actual
confusing.
cost versus projection.
That's
I
right.
mean-
is what
Last
I
year on
think is
January
what it-
7th, the board approved, with that same $32,000, they approved a total of $46,106. So they basically said, we're gonna go $14,100 over budget.
And where
Last
does
year.
that money then come from?
Well, that was all predicated on the thought that somebody wouldn't complete their project. Okay? And then that money just doesn't get used. So, what
where
we're
does-
trying to do is drive them down.
That's been the
Two.
history of the project for the past 6
Right.
years. They've always over budgeted for what's been, they've always over allocated for what's been spent.
And them numbers you gave us here, they'll be over actual numbers, what's been spent, the 30, we've been spending about 30 to 35,000, some years less.
46,000 the past
Yeah.
4 years.
So I think this year, when budget is done, we need to really, take a look at that and say, we've been at 32 for this long. It all, the majority comes from the Bowser grant, correct?
Yes, Lord and Soil Water
Yeah.
Resources grants.
And so perhaps maybe we need to really look at that. It's been the same amount for a long, long time. Costs haven't stayed the same for a long, long time. They're rising for everybody, and it's no different in this area. And this being one of our primary things, the lakes in this county, yes, it helps the individual who lives by this lake and their shoreline, but think what it does when the shoreline is completely eroding and creating this silt delta and mud delta down in the water. So a lot of money is being spent by the homeowner, which actually affects the homeowner and the county. So that is why I came forward with this, because Fronings they've got over $20,000 of their own money in this project, correct?
Correct.
And what we're trying to do, what you're trying to do is actually have us budget for what you think the cost will be. Where Paul was assuming we could do all these projects, which would never basically happen because of what odd reason. So last year, the commissioners budgeted for 48,000 for the same allocation, right?
Correct.
And this year, you're suggesting what we're actually gonna put out, which is 33,760.
But so is this for 2021?
This is
Yes.
for 21.
And how much, and so this all comes from the Bowser grant? It's not tax, it's not levy dollars?
No, some comes from the county.
Some comes from
See.
the county.
It has been, I don't know what the percentage is between the two.
I think we get about $19,000 from the Bowser grants.
But you gotta remember, last year, you guys budgeted for 48. So we're actually under what you were doing last year.
Well,
They didn't budget for it, but they approved it.
Approved it, I'm sorry, yeah.
Approved
then,
up to.
then I think we
Up
need
to,
to, then
yeah.
I think next year we need to do it differently.
Yes,
But
That's-
that doesn't mean I agree that we have to change it now, because then I have people on Lake Washington, maybe we should give them another 1,000, or we're picking and choosing here at this board. I just don't know if that's a good idea.
Is the Froning shoreline, is that the largest project going on of these? I mean, is that,
$5,000 request.
but I mean,
Largest study going on in this list is the Big Swan. We've done $175,000. And that's between DNR, Corps of Engineers, and everybody else that's going on with that one.
did you get a second or not?
I don't think we had a second yet.
Did we have a,
I'll second that motion then. I think we had the discussion before the second.
I think we did.
Yeah, but
I'm still not, you're gonna have to explain this a little better, Greg. So, we budgeted for, how much did we budget for 2021? It's not you, it's me, obviously, I've not been
I've got a
involved.
proposal for 32,000.
Okay, and we're spending 32,000.
Yes, that's what I've got.
Okay, that's what I needed to know.
We had 9 total projects asked for money this time. Last year there was only 6. I'm
Right.
trying to be somewhat fair, and the Frownings in the past, they've had 5,000 last year, they get 19 or $5,000 and 20.
So they
Now
haven't,
they're asking for 5,000 in 2021 again.
so other years they've gotten what they asked for?
Correct. 1 year,
2 years.
2
3
years.
years.
I just got that submittal last week. from
Okay.
the 20.
So, you know, I'm gonna go back to, every one of these has, they request, they don't get everything they want, and when you start picking and choosing. Lake Manuela got 0.
I gave that up. I was the treasurer.
They requested $3,000.
That was Paul who gave that.
Well, but they didn't get anything.
Yeah.
I just think when we start doing this, we're going down a slippery slope, so.
This, if Fronings were at 4,000, that was the day of the committee meeting. That was what was actually left with. Yes.
is that the way it is done every year? I'm new to this in terms of that, but you have to pick and choose each year and just kinda, no matter what. And now next year it could be down to 25,000 for all we know in terms of what they ask for and what we decide and
Yes.
how things work. And you just wanted to amend a little bit more just to cover the Froning project, right?
Yes. So that we would go back to what was agreed upon in the committee meeting
Right.
that day.
Right. So,
Now, will we actually spend it? We don't know. But that's what's been happening in the past. That's what we want to stop.
Yes.
So,
And that's why I kinda have these numbers here, trying to control it from going forward. Cause I just took this over too this year.
mhm.
And just going forward, we had $32,000 is what I see.
You know what might be helpful too, Greg, is if you went through and just, like you had that last 5 years, just say what we spent and what we budgeted, just so the rest of the commissioners kinda understand that what you're just trying to do is budget for actually what we're probably gonna spend, rather than possibly spend, which is what was the past, right?
I think
That-
the budgeting process in the past was to, here's what's getting approved every year.
Right,
If we budget up here, they're actually spend close to this target there was a blanket. And now we're trying to itemize a little bit.
Exactly.
Yeah, I mean, we're, instead of a projection, this is an actual.
right. And the projection was based on if it was a perfect world and all these lakes got what they wanted, or actually not even wanted, but where they could actually get them done,
Yes.
what it was, more or
Yes.
less, right?
and every one of them took less.
Yes, everyone.
Every one of them took less than their request.
So there's a possibility that they won't get all these done even,
Very good possibility, yes.
and then you'd be,
I mean,
Sure.
one of the projects, if I'm correct, Greg, has not even applied for a conditional use permit.
Correct.
So we don't know where they're at. We don't know what they're gonna.
so that's a very real possibility.
Star Lake got what they wanted, but they don't want 610 million.
So if we look at history, in 2019, the board allocated 35,554, spent 29. 2018, board allocated 38,591, spent 26,061. And in 2017, board allocated 34 and spent 25.
Yeah, I've
So
got page 2 here.
from that standpoint, the committee, which is made up of Dan, myself, and Greg, and then the MCAL board members, there was a bit of confusion because they had seen all of their requests be approved in the past. So,
I never remember a year when they all got everything they requested, if that's what you're saying, Paul. I've never seen that in all
No.
the years I've been commissioner here.
but if
That
we were
isn't-
32,000 and we approved well over that each
I
and every
believe
year.
when we have a budget, we should stick to it, so, you know, and if you're gonna start picking and choosing at this meeting after the then I would need more information or something, I don't know, I mean, Bell Lake, why are we picking them out instead of Lake Washington or?
Or why not give a little bit to each one then if there's
Right.
extra available or,
Manuela, you pulled, Star Lake, they're the only ones that got, and that was only $610.
Have they divvied these up though, proportionate kinda how they requested
We've never
though?
questioned it, I mean, it's always.
I mean,
come-
I'm just assuming you don't divvy it up because if they don't have a project, what are they gonna do with that money, you know? So it's not like, okay, you got zero, but maybe next year you'll get the 4,000.
Oh, right, they get if they have a project, it's been divvied up, absolutely. And that's the way it's been done every year. How they came to those numbers, I have no idea.
No, either do I. I mean, it's pretty new to us. We're just trying
A
to.
committee
Yeah.
meeting, and I
I'm-
suppose, and they decided at a budget meeting, or, I don't know,
I'm not sure.
but we have a budget for a reason.
Well, and it does state that the total monies for the program equal 32,000 per year from natural resource grants and matching funds.
There you are.
So that's where the number came from. And what I'm hearing Paul and Danny say is they're trying to get the MCAL, get everybody to understand that these dollars are gonna be closer to projections, we're not just gonna put $15,000 over projection, knowing that you're only gonna spend 60% of the money, which is gonna put us back at 32,000 roughly
Yes.
over a 5-year period. We're gonna start at 33,000. We're gonna hold you.
It's really not,
Opposed to the-
exactly, it's
we're
really
lowering
not
the top.
changing we're not changing the direction the water board has ever gone before. We're just making sure it's more of accountable,
Yes.
is what it is. I mean, it's different from the way Paul did things, you know, which was fine. I like the way Paul did things to some degree, you know, but now it's just more this pot, it's this pot, you know, so.
I don't think we ever had it broken out by Lake Association. It's detailed before
Yeah,
either.
we have.
Have
They
we?
always give us that, who's getting what. I don't know if we got the, grant allocations on the bottom from 3 years ago, but we always had a sheet of paper like this, I believe, that said this is what we were gonna do on it. We've never had this in-depth a discussion about it, that's true. Correct me if I'm wrong, Corey, we've always had this in the board packet. So, I just think if we're gonna do that, we should start that next year. I just don't wanna sit at this meeting and pick and choose somebody getting more than the other, that's just that's my feeling, and I will leave it
Well,
just at that.
And I tend to agree with Beth that we shouldn't be sitting, picking and choosing at this meeting. I do.
because isn't it a committee decision to begin with? They apply for 5,000 and they're allotted 4,000. Do they then have an opportunity to come back to that committee and renegotiate? Or not?
No, I think it's the way it's been expected, I think, and if Greg, if you see a different way of doing it next year, I'm all for it. I just don't wanna come and pick and choose today at this meeting. I understand what you're saying. And
This
they
is-
know they're not always gonna get, and that's why projects don't get done. You know, the lake associations work hard on this, and sometimes I've looked and thought, well, why didn't this lake get more, that lake get more? I've had calls, I don't have much lake area, but that's just how we've done it. And if it's
And
gonna
I think-
change, I feel like we should change it going forward.
And I think, one of the I mean, it all depends on which lake association is more effective or active.
Oh, yeah.
And, you know, you have lake associations that don't accomplish a whole lot, so then,
I think most of ours do a lot.
no, and I'm not,
And a given.
I don't wanna pick
No, I know
winners or
what you're saying.
choosers
I
in that
know.
either,
And it
but,
depends on what projects they
yeah,
need or
and what they can get.
do, so.
Is this money, it's been allocated, okay. Lake Washington got 4,000. If they do not complete their project this year, do they get to keep that 4,000 in a pot
No.
and use it the next, it's a,
No.
yep, okay.
And that's
That is
what
one
I,
thing that has changed over the years too, because that hasn't always been the case.
Oh,
because apparently in the past, Paul's awarded after the fact, usually after the fact. And that's where I looked at kind of in the future, I thought that's pretty dangerous to
Right.
award something a year or something after the fact. If they come back after it, they have to kind of set, this year we're gonna set kind of a line in the sand of use it or lose it.
And I'm in full agreement with you.
That
That's-
hasn't been in the
Yeah,
game in the
that's-
past.
And I think you'll change those things going down now. It did always come from Paul before, and I just think next year's a good time to start it.
Does this need to be approved today?
Yes, we wanna get out to the MCAL board.
But other than that,
No, if you wanna discuss it further, we could pull it till next.
well, if
one.
I withdrew my motion and you withdrew your second, I would move to table it to the next meeting.
What good's that
For
gonna
what
do?
reason?
Yeah, I'm not
Well,
gonna
let's-
change my mind. I don't
You know.
think, maybe, if you've got different
Are you
information.
clear? I mean, is everybody clear on it? You know, I'm not trying to push something through here that I want everybody to
I just think
just
whether
vote
we
on
do
a
it,
given day.
whether we do it today or next time, we're picking and choosing something that has already come before the board, and I would rather just change the way we do it next year.
Because would that 1,600 or whatever amount difference allow them to complete their project if they got that much more?
They're gonna go forward anyway. That project has to happen. They're in with the DNR on it. So it's a DNR project. So, no, it's gonna. You know, the one thing that Greg does not have, due to the way that we, and this is just speaking out loud here, is on these particular ones, Greg doesn't have the power after today that if someone else doesn't complete their project to manipulate any of the money or come back, I suppose you could come back to the board and say, these funds weren't used and I have a request. But that's just something to think about for the future too.
But I don't think we wanna go down the road like you were talking about, that 5 years from now, they come back and say, well, right, we don't wanna do that.
I'm saying within the year, that might be
So if there's
something.
some policy you wanna put in too in the next year as you go forward, that might be a fine idea, but we just don't have
Well,
it, you know what I'm saying?
Yep.
Paul?
I think we're, no matter how we slice this up, we're a lot closer to the actual number at 33,760 than we were at 48,000 spending 31. You know what I mean?
That
So
was
I'd
back
rather-
when,
I'd
that was
rather-
back when I never knew what the allocation was, I guess, I don't.
Well, and
I don't
that's-
remember seeing
I'd-
that number.
Being on budget, I'd rather be within 2% of projection than
Which
being
side do you want?
30%.
I wanna be
with
on
a
the other side. of the-
30% of a margin above and beyond. They could have spent up to $48,000.
And I
I
think,
assume we would have had to pay it.
and I think the reason Paul
I mean-
Vergnig did it that way is in case someone did actually complete it, he didn't have to say, no, sorry, we don't have the allocation for you this year. But in the reality of it, the projects just didn't get done, you know, but I think that from talking with him, that was his logic going into it. You know, he put a lot of faith in these lake associations and said, okay, we're gonna allocate it. So if they did get the project done, you had the money for it.
He didn't need to come back to the board and say we
Exactly.
need
Like
15
like
grand.
Paul's saying right now, it's like, you know, once you have it set, you know, Greg has his number set, that's his number.
Yep.
You know, and
Well, we
if-
do some different things with budgeting that maybe will change cut in the next year or two. I'm hoping some things do. So I'm looking at Andrew now, but you know, we do things like put in social workers and say we're never gonna hire them. That kind of stuff. That's getting off the rabbit trail here, but you know what I'm saying. So I think a lot of this will change. My only objection is I just don't think this meeting is a good time to change the recommendation that came before the board. And if you wanna do it differently next year, I'm all for it.
Well, but just so I understand this correctly, but the committee approved the 33,760.
Yes.
Okay. I'm fine with that. I mean, like I said, we're closer to the target than we've ever been before.
And that's what we wanna
And which
convey
will
to the
set
committee.
precedents
That-
for this June, July, when we start working on these budgets. That's this is what we're doing moving forward. This is setting that precedent.
See, in the past, when they had the committee meeting, all these grants were there, all these requests. Nobody looked at the bottom figure or what it was gonna be at the end. They just approved. So this year was the first year where we took that first step in saying, no, we're not gonna do it that way. This is the way. So next year, they will know ahead of time, this is the figure, period, end of story. And so when we get down to that last, all right, that's the figure that's going to be approved.
Well, and they'll be able to look at their projects much more targeted throughout the year, what's coming for 2022, and say, okay, well, you know, we're gonna have to spend, you know, we don't automatically get 5,000 or
Right.
6,000.
That's the whole point.
We're,
Yes,
and there will be bigger projects some years and smaller ones, and no
Exactly.
projects on some lakes, so it's never gonna be a completely, the day to day, year to year, the same for every lake.
and
They're
just a
gonna have to-
reminder, and I'll just take Lake Washington there. To get 4,000, they have to spend 8, and then they get 4 of it back. This isn't just, okay,
Yeah.
we spent 4, we get 4. No, I spend 4, you get 2.
Yeah.
You get 50%.
Yeah,
So,
And these are all in-kind grants,
yes,
50% in-kind.
yeah.
It's just a different way of looking at it, and hopefully we're trying to make it more
yes.
good, better for the association, so they know what to expect, and hopefully more reality for the county too, of what we're paying. Yeah,
If I may for just a sec, I think what we've heard and what we've seen is the reason why the allocations occurred previously was to try and maximize that amount that was budgeted. And it was a process that typically worked fairly well, as you can see by the actuals spent. But it may not be the best process or the best way to go about that. And so it could be worthwhile to have the MCAL board have a meeting to talk about what can we do to incentivize people to really pursue these projects. Because what we don't want to do is allocate $32,000 because that's what we budgeted and only spend 17,000 of that, when there are people who are then saying, well, I could have built a project, or I did build a project and I asked for more. So what we need to do is find a way to incentivize people to make sure that if they get a grant, that they actually are going to go forward with the project. So maybe that's a task that you as the county board could ask the MCAL board to take a look at and come back with a recommendation prior to next year.
And I think the other thing we need to ask them is when they put in their grants, we need a little more specific estimates, because I think they're ballparking sediment checking and mapping. You know, how was that estimated? You know, is that just a figure because that's what we did last year? You know, those things, they need to be a little bit more concise.
Greg, do you know what percentage of these projects don't get done?
Very
You
easy.
don't know either.
Well,
And
that's,
You calculate the allocation, what was spent.
varies
over the
year to
past 4 years, you can get that.
Okay.
it really is a proportion of whatever Paul just said though, like the one year it was 25,000
Yeah,
spent with
that's right here.
34,000 allocated. I mean, you could just use those proportions of what, if you wanted to actually, what was, you know, what they could have done and what was actually done, so.
last year was 16,500.
Yeah,
That's a third.
yeah,
It's 33%.
I really think it's just a different way of looking at it. I don't think it's gonna change much
Yep.
of what the lakes do.
And it actually is going to change the way the lakes associations work and starting today. I mean, they have to look at this a lot differently
And-
versus spitballing it, which was
Right.
kind of what they were doing. I mean, and it worked, but
No,
this
I-
is much more targeted.
Talking to Paul, I understood exactly why he did it the way he did it, but,
Sure.
you know, you just have to move forward with, you know, we're moving forward without Paul now, and
And to Beth's point that we're picking and choosing, I wanna clarify that. We had, and Greg, you were there, all of those were set at 4,000. That was the only one that changed from the committee meeting to this presentation
Changed
today,
because of the 32,000
yes.
FEMA.
So-
Knowing what exactly is, but
So we're not picking and choosing. I'm going back to
Well,
Froning's.
you are picking and choosing, cause then I'm gonna say, well, let's give another 500 to Lake Washington. Greg's recommendation is what's before us.
Yes, it is what is before us.
But the
Anyway.
committee recommendation was for 4,000 for Froning?
Yes,
Okay.
yes.
I agree with Beth, it is kind of a slippery slope. But looking at it where they had all asked for 4,000, why would, why was Bell Lake, you denied them because of then the ceiling of the budget? How did you pick Bell Lake as the one that wasn't going to get the additional
Because
funding?
the past 2 years, they received 5,000 for each year for 19 and 20. They've already received $10,000 on
Still-
So we can talk this to death,
Yeah.
but that's why I go back to, we should take this recommendation, and if you wanna change the way you do it next year, I'm all for it, so, on that, I mean, we can vote on it.
So gentlemen, do you request to remove your motion and second and simply approve what is before the board? Or how would you like to move forward with this?
No, I won't rescind. Let's vote it, and if it goes down, it goes down. If it goes forward, it goes forward.
Okay,
If not,
we
we'll
have before us a motion with a second to increase the giving to the Bell Lake project to the tune of how many dollars again was this?
1,760.
1,760.
So you're giving them the full
4,000.
4,000.
That would come up to the 4,000. And do we need to do this on a roll call, or can we simply do a voice
Well, you
vote?
can do a voice vote.
Do a voice vote. Any further discussion? All those in favor, say aye.
Aye.
All those opposed? Nay.
Nay.
I believe it carried. Right. So now, help me with the parliamentary procedure on this. Do we still have then before us?
They just have to, you have to change it,
12. I'll
right?
edit it.
He'll amend it,
It's amended.
yeah, it's fine, they'll just get more money.
Would be amended. So do we need to approve this then as amended today?
Oh, we just
I
did.
believe the motion included approving the entire thing with that amended amount.
Okay.
So that was the entire item, so we're on to the next agenda item.
All right. Moving on then,
All right, next item I've got is the approval, hiring a part-time administrative technician, Nicolette Larson at DBM B21, step 1, $19.28 per hour with a start date of February 8th, 2021. And Nicolette is replacing Phyllis Pranter, who retired in December of 2020.
Move to approve. This is a replacement, right, you said so, move to approve.
Second.
okay. So we have before us a motion to accept the hiring of a part-time technician, Nicolette Larson. We can do this with a voice vote.
You have to have, see if there's any discussion.
Okay, I had a question. Is Phyllis Prantner, is that spelled correctly? P-R-A-N-T-E-R? Prantner, okay. And she had been a part-time employee, so this is a replacement. Any other discussion on the hiring of Nicolette Larson? All those in favor, say aye.
Aye.
All those opposed? Motion carries.
So I got one, I'm gonna go back, we already voted on it, so you have money, if I'm understanding this, the water plan, no, that isn't gonna take levy dollars, that's just, you're still up to where you have to be for,
Correct, I believe so.
okay, thank you.
Okay, thank you, Greg.
Thank you.
And
Thanks,
we have Brian.
Good morning.
Good morning.
Morning.
Brian Cruz, County Sheriff, just two items before you here this morning. Both of them are non-budgeted items that kind of surprise us, and that's why we're coming forward with it. The first one is the lighting system on our tower down in Dassel. To give you a quick history on this, this tower's been there for over 20 years. This was actually on our radar to do in the future. We were looking at next year to replace this lighting anyway. But in the past month, we've had the vendor out there several times. We haven't got the bill for the last one, but the bill before that was $2,500. So the lighting system that's there now is an old strobe system. It's end of life and it really needs to get replaced. There are some public safety issues that are of concern with this. Obviously our airplanes in the area, but along with that, because the lighting system's not working, we've had to turn on the white lights at night, and that sits right on Highway 15. So there's a couple of concerns beyond just making sure the lights are working there. So we did have the vendor do a proposal for us, and the proposal to replace that lighting system with an LED system, and then moving forward would be $12,000. So my request before you is to approve that. I did talk to Andrew, and there is money in the capital projects funds to take care of this, because again, this is not a budgeted item in our budget.
Will that have a warranty?
Well, there would be an initial warranty, but like everything else, it'll eventually wear out.
So, Brian, this is a shared, we foot the bill for the 12,000, but then we get some kickback on that, correct?
Correct, yeah, good, thanks for bringing it up, I forgot that. So, yeah, we are in partnership on that tower with two other vendors, so we will only ultimately pay a third of that, we'll get 2/3 of that.
Of the 12,000.
Right.
Oh.
So our end, at the end of the day, our cost will end up being $4,000.
Okay.
Because it's on county property and we are the ones who are in charge of that tower, this maintenance falls on us to begin with, that's why it's coming through us. But we'll bill that back.
And repairs was 2,500.
That's
That was a
billed
one time or twice
That's
already?
only one, we have another bill coming.
Okay.
This last go out, so I'm not sure what that will be.
So basically, you've already spent what it would have, our third would have been probably. Okay.
And that we encumbered all through Meeker County, or did we share that repair cost?
Share that, right. We'll share that cost as well.
So we'll split 25 with the rest of the guys. Okay. Where will the additional monies come from if this is not a budgeted item?
Out of that capital projects fund.
Comes from there. Okay,
We have fund reserve in the capital projects fund
Okay.
for unexpected expenses like this.
okay.
So basically, we're about a year early.
Right.
What was projected. You know, we were projecting we're gonna have to do it next year.
Have to do something.
And it's costing us more to maintain it. We might as well bite the bullet.
Yeah.
Is basically what he's,
I'm assuming there'd be an alternative other than doing this otherwise you wouldn't have brought it up, right?
Right, yeah,
Yeah,
the only
I mean-
alternative is to keep repairing it, and,
Yeah.
I mean, they're the experts, and they're like, it's a 20-plus-year-old system, and it's really end of life, and,
I'll make a motion to request approval for the lighting system.
Do I hear a second?
I will second that.
Any discussion on this motion?
So this will be $12,000 less in your budget next year.
Yeah.
Thank you, Sheriff Cruz.
All right. And you negotiate with the other two parties to cover the cost of this?
yeah, that's actually an agreement that's already in place, so we will just bill them straight out. Yep.
Any
You did-
further discussion?
You didn't say that like you meant it.
But that will-
About the 12.
oh, yeah,
Send them the bill.
Commissioner Olberg will bill them out.
line item.
Well,
have a motion to approve the replacement on the Dassel Tower. All those in favor say aye.
Aye.
Opposed? Motion carries.
Okay, and the second item before you is, again, this is a non-budget item, so I'll give you a history on this. About 3 years ago, we did upgrade our NG 911 system. At that time, the cost to put the software and equipment in place for text to 911 was $12,000. We found another PSAP that agreed to take our text 911 and then give them to us at a cost of $100 per year. In December, I got a bill from that PSAP for $2,400 for year 2020, and they told us in 2021 it'd be $3,600. We are not gonna be paying the 2021 bill. We're still in dispute on the 2020 because there was no agreement. Having said that, it's gonna obviously cost us a lot more to continue to outsource that. The cost of the equipment came down significantly to do it locally versus outsourcing. So before you is a proposal from IES, which is our vendor that takes care of our 911 system, for $2,509.64, and that will install the equipment needed so we can take the text 911 directly at our PSAP center, not source it out and no longer pay other entities to do that service for us. So my request is for that to be approved, and that's another capital project fund. We had no intentions, if they would have stuck to the original agreement of $100 a year, we had no intention of moving that unless we had to because of volume. But this obviously changes things, and the cost is too much, and the cost to install is down significantly, so.
You know, when I think of capital projects, for some reason, I don't think of a $2,600 project as being do you know what I'm saying, Andrew? So when you say it's extra, it's really for capital projects, larger improvements. I don't want people to get the idea we have a slush fund going.
No.
You know what I'm saying?
no,
though?
but I
When I
agree.
think of a capital project, I think of the
Right,
so.
but I think that fund is also there for these things that we don't expect, and it's somewhere, when you look at.
Maybe, but I'm just saying, I don't want people to think we have this there for. Guess it doesn't matter if you
I'm
need
a
it,
little
you need it.
confused in that other, you said it was $100 per year,
So initially, the agreement was $100 per year,
right?
and we got a bill in December, and they're saying it's $200 a month, you owe us for 2020. And then going forward, it's gonna be $300 per month in 2021.
Was there an agreement signed or was it just? So what you're saying,
That bill is still in dispute, we haven't paid that one yet.
what you're saying is that is what the outsource cost is gonna be, is the real cost is gonna be, and whatever the $100, did that ever come?
It did initially,
Oh,
but going forward now, it'll be $300 per month, so it'll be $3,600 a year.
$100
They say
a
why
year.
they changed it,
Yeah.
just cost of living or what, cost of doing business, huh?
Maybe, I don't know.
Nothing changed on your end.
Nothing changed our end, and we still get a handful of text 911s. I know that, I think statewide is going up significantly, but we haven't seen that in
I wonder why.
a year. I would suspect that as it goes up elsewhere, we will see an increase here too.
Maybe the age of our people and stuff.
It's something, emergency services board too, we talked, in the next gen committee and text 911, we talked about all this, and it's something that they really, I think when it first came out, there wasn't a lot of infrastructure to support it, so that was one of the reasons, they actually weren't promoting it, because some of the, getting the bugs worked out of the system and stuff, and now as we get a couple years into it, it's gonna become more of a common theme, and they actually will promote it, or, advertise. It's been kind of a hush-hush item that they didn't bring forward just until they get some of the bugs and kinks worked out of the system, and now we're seeing that, and apparently somebody's increased cost somewhere if they're bumping our bill to $300 a month, and we can install our own for $200 a month, so.
So if I text 911, is that like a one one key press or something on the phone, or?
So in the, where you normally enter the person's phone number, you just enter 911, and then you send your text. And then, currently it'll go out of our county to another PSAP. They can respond to you, but then they get on the phone to us and tell us, this is the information we have, and this is, what the call is. And what this will do is it'll bring it right to our dispatch center, and we'll handle it directly.
So the initial sorry. Go
Sure,
ahead.
that's a pretty reasonable dollar figure. For installation, is there software, is there, what,
All inclusive. So actually what we did 3 years ago is we prep for a lot of things that we know are coming down the road for NG 911.
okay,
And even though we didn't install the equipment, that we prep for that. So our system that we have is ready for this stuff and compatible. So that's the bottom line. There is no additional cost.
we can attach it for that.
Yep.
Is that part of the Zerker update, or not
Nope.
part of Zerker?
No,
Okay.
but Solocom is our 911 system that we
Okay.
did a few years back.
There's no upkeep costs on that. I mean, it's $2,500 and then that's it, basically for the lifetime of that.
Right. There are maintenance costs we
Right,
pay to
so-
Solocom. And that will be part of, Solocom is the vendor or IES is the vendor, Solocom is the actual equipment. There are, maintenance and upkeep costs, but this 911, text 911 gets wrapped into that. There's no additional maintenance. Our maintenance that we pay for that will cover this.
Yeah, I'm just saying, just so going forward, you don't have the agreement of $100 and then suddenly they come and get you for whatever, you know.
This wraps into the maintenance we already have, no additional maintenance.
Any further discussion on the motion to accept the 911 edition? All
I don't-
those-
I don't think we got a
Whoop,
motion.
we don't have the motion yet?
No, we do not have a
So we had
motion.
the discussion before the motion. I tell you guys, be
I'll
patient.
do you a favor, Madam Chair. I'll make a
Thank you.
motion to approve the text 911 system.
Do we hear a second?
I will second that motion.
Okay, now we have the motion. We've already had the discussion. Do we have any additional discussion? All those in favor, say aye.
Aye.
All those opposed? Motion carries.
I do have one matter of information for you, because I did have a couple questions on, we had an invoice go through for $60,000 for Zerker. Just really quickly, I think I answered them directly, but just for the group, so that $60,000 is our maintenance fees on our Zerker system. That's our new computer-aided dispatch, records, GL mapping system that we have in place. The old system we had, we installed Zerker a year ago. The old system we had was CIS. That maintenance fee was in the neighborhood of $45,000. Don't quote me on that. So the maintenance fee has gone up, but that has to do with our computer system, and that's the annual maintenance cost, and that's by contract when we bought the system. So, if anybody has any questions on that, or
I can just,
I sent you the email yesterday asking because I didn't understand what TriTech Technologies was.
yeah, they
So-
go by. We know it as Zerker, and then it's Central Square, and then TriTech is the I don't even know what name they really go by. So
Okay.
there's a lot of companies there.
and I sent Brian an email yesterday too to break that one down a little bit. On the backside, on the fire rescue side of Zerker, what that did for us is once the county installed that system, then we get a full, it used to be paper. We call in when we came back and fill out a log sheet. And then that's how we did our reports. But with Zerker, we then, when the call gets closed out by the county, we automatically get an email and it gives us everybody who was on, every organization that was on that call, ambulance service, time they arrived, time that, it gives us everything in case there was ever a lawsuit or something like that. We have all the data that we need to justify, here's when we got there. We get disputes every once in a while.
sure.
So it's added a lot to the local organizations around the county too. Every rescue service and fire service and ambulance service in the county works off the Zerker system too. So very more robust system than what was in place. Like I said, it was pen and paper, you know, until a year and a half ago.
This, so the really big selling point to move to the software is it integrates with all of our divisions in the sheriff's office. Where the old system, so if a deputy ran into somebody in the street, they would input their name. If they brought them to jail, you'd have to re-input all of that. They didn't work across the divisions.
Okay.
On this system, the first person that puts that name in, it carries all the way through, and it's a matter of a click. You don't have to re-enter it. So there's been a lot of manual work that went away with the system. One thing I will say with that $60,000 maintenance fee is there are agreements with the city of Litchfield through our records and through dispatch. They pay a portion of that, and then Eden Valley PD pays a portion of that as well. So that full brunt of that $60,000 is not borne by the county because those are major users on our system.
It's shared, and the costs are shared.
Yes. The initial cost to install was shared, and then the maintenance was shared as well, so.
Very good. Any other questions?
I just got a
for
quick
Brian?
question, and I know I've seen this bill for, the drug task force.
Yes.
And some $1,000s. So what does that include, and who do we split that on? I'm sure we've had this conversation.
Yep, so every,
I don't recall
the
it.
drug task force does a per capita, they get some money from the federal government and the state government, and then they do a per capita, I think it's $5 per resident in the county. And so we belong to that, there should be 5 counties in that system right now. What we get out of that is we have 2 agents assigned to the task force, and the money we pay in, goes towards their salaries, so we get reimbursed, 2 salaries, salary, and benefits
Okay.
off those employees. And then that gives us immediate access to basically everybody on that task force. And we're working on the year-end report, and you're gonna see this year we had record drug seizures in Meeker County, and they spent a lot of time in our county. So rather than having one person in our county, in our detective unit, we get 5 people that can come over at a whim. And it really is a cost-effective way to combating the drug problem. When you look at it, we pay in and I can't remember what it is, just over $100,000.
$150, yeah, I don't have it.
We get the full salary benefits back in 2 employees.
So does that include some training and things too, or,
Yep, all the expenses involved with them gets reimbursed.
and what counties are with us on the drug task force?
Meeker, Candy, Swift, Yellow Medicine, and Chippewa.
Thank you. I saw that and I'm like, well, I'm sure we've talked about it, but,
Yeah, that's an annual expense. There hasn't been an increase in that per capita in 2 or 3 years. We just talked about this. There's probably gonna be next year, and that has to do with personnel expenses.
all right, good, thank you.
Thank you.
Very good, thank you, Brian.
Thanks, Brian.
Yeah. Paul, I believe you're next on the agenda.
Good morning.
Good
Paul
morning.
Bukovich, Meeker County Social Services. The only order of business I have before you is our accounts payable.
Move
That
to
was
approve.
kind of a boring one, to be honest.
Oh,
Yes,
I was
so-
depending on you to find something.
Just to acknowledge Commissioner Oberg's last question of me, she threw a fast one at me.
Uh-oh.
I don't know if she intended to do that, but she pulled one off of the previous accounts payable. So, thank you.
thank you.
OCD kicked in. So,
All right.
I'll make a motion to approve the accounts payable for social services, Madam Chair.
Do I hear a second?
I'll second that motion.
Okay, we have a motion and a second to approve the accounts payable. Any discussion?
So it seems to me like we're paying a lot of attorney's fees right now. Is that true or?
which line?
Well, I
item?
mean, I don't know. I don't have it in front of me, but is it a lot of chip cases or
Yeah.
a lot of things? Yeah, I don't.
Oh, so county attorneys, yes.
Court-appointed attorney.
Court appointed is the word I was meant
Yeah.
to say. I
Okay,
apologize.
yeah.
More than usual, or am I just noticing it more than usual?
Well, our caseload has gone up.
For CHIPS
So, I mean,
cases.
the number of reports that we're dealing with, the number of cases that we have going before the court goes up. So we do have the responsibility of not only ensuring that parents are adequately represented, but children also have the right to have their own attorney. So what you may be seeing, and I haven't really done a full analysis of this, is that more children are actually
Well, that was-
asking for that.
That's my guess,
So
yeah.
children are actually appointed by a public defender, and so the state pays for the children, but if the mother has 5 children and there's 3 fathers, all 3 fathers plus the mother get their own attorney, so you'd have 4 attorneys, which has been a case before. So, and then if the cases go to trial, then obviously the more time it takes to review the discovery. If the cases have been in the system long enough where we've been tracking all the documentation and the bad behaviors and the concerns, but haven't gone to chips, all that discovery or evidence is then reviewed by the attorneys, and they get to track their time for reviewing all discovery, medical records,
And
reports.
I see, and I'm not gonna, it doesn't matter, but I see a couple attorneys in
So we
particular.
have a hierarchy of the attorneys at the court appoints the attorneys.
So it
I have
hasn't,
no-
it doesn't go, we just cover the pay, or, I mean,
Correct, I literally just review the bills to make sure that they are consistent with the number of hours that my attorneys are, putting in on it. And I ask them, is this a case? So we're reviewing those bills, those hours in comparison to what the attorney.
so you do have something you compare them to, they can't
Yes.
just have a shot in the dark and say I spent 40 hours on this case, that was kind of what I wanted. Thank you.
Thank you.
I couldn't find anything else, I should've went back and looked at last month's,
And by the way, thank you, because we actually coded that incorrectly. That's what
Okay.
threw me off, and so I went back to our accounting department and said, oh, that wasn't supposed to be under Rule 5. That was supposed to be somewhere else. So, good catch.
Very good. Very good. Any additional questions or discussion for Paul? Okay, we have the motion. All those in favor, say aye.
Aye.
Opposed? Motion carries.
Thank you so much
Thank you.
for your time.
Thanks,
Very
Paul.
good, Paul. Phil, I believe you're next.
Good morning.
Good morning.
To watch myself today.
Okay.
Okay, I have 3 items for board consideration this morning. Again, Phil Schmalz, Public Works Director. The first item I have is approval of our 5-year highway construction plan. This is the same plan we reviewed at last week's workshop with one notable exception. If you look in the year 2022, that parking lot pavement replacement we discussed at the Darwin-Dassel rest stop is in this plan. It was omitted from the one we looked at the workshop. And that, again, I'm seeking basically MnDOT funds for that project.
We did discuss it though, didn't we, at that meeting?
We did a
We
lot.
discussed.
Yeah.
We discussed
I brought it
it,
up because I was surprised I didn't see it in there.
Oh.
Didn't make it into the copy I printed, I guess.
And I do wanna thank you, that was a good, good explanation the other day during that work session. It cleared up some questions I had, and it made it a lot clearer, so thank you.
You're welcome. So I request approval of our 5-year highway construction plan.
I'll make a motion to approve the 5-year highway construction plan.
Do I hear a second?
I will second that.
Any discussion? We'll take the vote. All those in favor of the 5-year highway construction plan, say aye.
Aye.
Opposed? Motion carried.
Second item I have for board consideration is to authorize the highway department to advertise our 2021 projects. On the list that I sent you, the one project you will not see is our CASA 6 reconstruct and pave. We have a contractor selected already from last year's contract. But otherwise, these are the projects we're looking at for this year. We've got our countywide pavement marking, countywide seal coating on various routes, and then a notch wide and blade level on CASA 6, that kind of ties into the CASA 6 grading and paving. Notch wide and blade level with an overlay on CASA 1 from Trunk Highway 7 up to Litchfield. And then 2 bridge projects, one of them on the north end of Big Swan Lake, and one of them is a township bridge, the outlet of Lake Ripley. So I request board approval to set letting dates for these projects for 2021.
Move to approve.
I'll second, Madam Chair.
Okay, we have a motion for the letting dates. Do I hear any discussion? No discussion, we'll take the vote. All those in favor say aye.
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 All those opposed? Motion carries.
Final item I have for consideration is to approve the mailbox policy update. We discussed it last week's workshop. Brief summary, the old policy is about 10 years old. We were still acknowledging that we would repair old wooden structures. That's the biggest change I wanted to see and some clarification. So I request the county board approve our updated county mailbox policy.
I move to approve the updated Public Works mailbox policy.
There you go. Do we hear a second?
I'll second that motion.
All right, we have a motion and a second. Do we have any discussion? Okay, we'll take the vote. All those in favor of approving the mailbox policy, say aye.
Aye.
Aye. All opposed? Motion carried.
Thank you.
Thank you.
Thanks, Phil.
Phew, very good.
You've been pretty fortunate with the snow, haven't you? I knocked on
Oh.
wood.
Say it.
I shouldn't
I
have.
know.
Had to say something.
My
didn't you?
mistake.
Yeah. Cold, I guess, is coming for the weekend, but hopefully not so much snow.
Cold we can handle as long as we don't get snow right before it. Well, there is some in the forecast, but if we get it scraped off, it'll be okay.
Very good.
Thanks,
Thank
Phil.
you, Phil. Okay, now, next on the agenda, we have Barb.
I
But
believe Andrew went down to.
we're running a little behind schedule here according to the agenda. But we'll get Barb to come up here. All right.
How are you today?
Is that our labor attorney?
I think so.
Hello, Barb.
Phil told me he was gonna be more than 5 minutes.
You're next.
Okay, good morning, Commissioners.
Yes.
The item that I have is a resolution for supporting the grant application for the DNR Federal Recreation Trail. And in your board packet, I had intended for a supplement to be put in there, and I guess that didn't hit there, so I'll read it. Meeker County Snowmobile Trails has requested a resolution in support of applying for a Federal Recreation Trails grant from the 21 Grant Equipment Fund. Applications are due on February 26th, with awards expected no earlier than mid-October. This grant is being considered as the club needs to repair their Tucker. If you've seen their Tucker, it hasn't been out much this year, but the track is completely damaged, and the estimate is to replace the track would be $30,000. Other issues on that particular Tucker give them an opportunity that they may wanna look at something different, rather than putting that much money into that particular unit. They did locate one in Grand Rapids. They went to look at it, and it's a favorable purchase if, in the event that they were given a grant, because their fund doesn't have the amount of money that they would need. The quote is $175,000 for the replacement Tucker. I did ask them what they were gonna do with their current one, whether it was gonna be on standby, but because they were getting the same 200E series, there might be opportunities to exchange parts. So the permissible maximum for this grant is $75,000, and the club's in a position to provide for the remaining from their savings. So in other words, they have $100,000 in the fund, and with this being a light snow year, they felt that that was gonna be something they could handle. These funds are only available through government sponsors, and that's why we have been a sponsor for that club and for their types of grants for a long time. And so I'm asking that you approve that resolution that you saw, outlining the requests that they're making. It recognizes that 25% of the match requirement for the federal unit, but obviously their amount that they're asking for is a lot greater than that. And it also lays out some of the environmental requirements and regulations. This particular resolution was provided in the text that it is, so it wasn't something we developed here in Meeker County to set the rules.
Does the DNR react fairly quick when they receive a grant request, or are they
there's a very long, presentation that they have to put together. It's like about 6-page request. And when you, were to go on and look at the Federal Recreational Trail Programs equipment grants, there's a manual, and it does provide that they won't be making decisions until mid-October.
Oh, so this one that they have found in Brainerd may not be available anyway,
Well,
or?
they were going back and forth on that, so I'm not positive what's gonna happen
Oh.
there, because they're, you know, it does say here that the awards are expected no earlier than October, but I didn't find in here, and I thought we had discussion that they would be made aware prior to that.
Oh,
So
okay.
hopefully, they, you know, I don't know how fast Tuckers move and, you know, whatever. But that was a question I did have when I was working with both the Manana Snow Blazers and the Darwin Drifters.
And they share this piece of equipment.
Yes, they do.
And we only have the two clubs
We only have
in
the two
Meeker
clubs.
County?
Yep, their membership is minimal, and we do help them with the grant that's, we come to the board every year, they get, I don't know, $60,000 or $70,000, depending upon the snow year and the permits and those types of things, to work with grooming and, obviously their equipment needs. This was, you know, an opportunity, I guess, the only thing that could be is not get the grant and not go forward. But they do need to address the Tucker and its needs right now, especially when it's a 2001 version. And, you know, 20 years later.
So this is basically just a grant. If they don't get the grant, then they go to Plan B
They
or
may
C.
go to Plan B. I did look and I did share just a little bit of that information with them. Back in 2001, 2, 3, in that area, the county did assist in purchasing their original grant, or original Tucker by offering them a short-term loan. So they paid it off over 3 or 4 years with the funding that they got. So maybe in the end, if this doesn't work out for them or doesn't happen, maybe that's an option that they'll ask us to come back and look at again.
Okay.
But this doesn't include any taxpayer funds. We're just simply a guardian, or not a guardian,
We
but
just
a helper.
we just pass through.
Yeah.
We're pass-through,
Facilitator.
we're sponsor.
Yeah, facilitator. Yeah.
But part of these funds that they're tapping into are those recreational and safety walk and those types of things, grants that we hear about every once in a while. So
Okay.
it's the same program that they're looking at to tap into.
Madam Chair, I'll make a motion to approve the request for the grant application for Minnesota DNR Federal Recreation Trail Program, Resolution 2021-04.
Do I hear a second?
I'll second that, Madam Chair.
Thank you. We have a motion on the floor. And do we hear any additional discussion or questions? All those in favor, say aye.
Aye.
I'll have to do a roll.
Oh,
Sorry.
yep,
Yeah.
this is a resolution. This is a roll call. Would you like to call that for me, Corey? Thank you.
Commissioner Schmidt,
Yes.
Commissioner Schiefelbein,
Yes.
Commissioner Bredesen,
Yes.
Commissioner Johnson,
Yes.
Commissioner Olberg.
Yes.
Good.
Okay, the other item I have is the payables that were sent to us.
I'll move to approve.
I'll second, Madam Chair.
Second. All right, we have a motion to accept the accounts payable. Do we have any discussion?
I have to ask a question. I see that we pay for Kingston Township recyclables. Is this something we do for all townships? Or is this,
Wow.
The answer would be no. I only see that particular one when I did that little bit of research that you asked about yesterday. So I think we need to check with Greg in the transfer.
he thought maybe Dassel also.
It's possible, but I know we don't do it for all.
Is it oil filters?
Could be that too.
Because
There's one out at
there's some,
Phoenix also.
there's a few of them are around the county, but, I don't know how exactly the program works, but that's what I was thinking was the oil filter.
I was just, the reason I asked was I thought, wow, we're getting a $7,000 one for this township. Now next month, do we get more townships and the
No.
month after
No,
that?
and
So,
It's not all of them.
I think
Okay.
there is a oil
The
reclamation.
Kingston Township, isn't that for recycling?
I think it's recycling.
Yeah.
Are you aware of that one?
There's
Because
a-
Yeah.
we do pay that bill back to Kingston Township.
Yeah. Yep, I thought we had a partnership, or we paid half and half or something, I'm not sure.
Possible, because when I pulled up, I was doing, audits for a couple of different areas, and Kingston was one that asked for a payment audit, so I pulled that one. And then Paul asked me about that expense at the same time. But we get an invoice from Kingston Township, they share a billing with us, and then we in turn pay part of it. But I think either referencing, Bernick's history or checking with, Greg will be the way to sort that out. But it's not all of them, very definitely not, as I
Is
pull
there-
those audits.
Is there a recycling center by the garage over there?
Yeah.
Is that, okay.
Yeah.
Then that's,
Yeah.
I was thinking oil, but
I had no idea.
there,
Other
I know there's
towns-
I know there's a recycling of something over in by the Kingston garage or shop, and that's where.
No, it's recycling, and, you've done it for years too, right?
So-
Yep, the payment.
And the
is
whole,
one.
the whole theory behind it is just so people don't throw it out in the,
Here,
you know, that, and that we've had Kingston Township cleanup day and stuff, just so there's less trash in the ditches and more, you know, more just go there, you know.
But there is also an oil filter one too that I saw. when I
Okay,
was-
and
when
I-
was
that's
doing
what I was-
somebody's audit.
When I seen it, that's what I was thinking of.
so we're clear, I'm all for recycling, so,
Oh, absolutely.
you know,
Yeah.
I just was wondering if we were gonna be getting one from each township. was
No.
what I came-
Yeah, I
Not
never
a-
knew that other townships didn't do that then.
No, I believe I can look for it a little bit harder in Fund 17 if you like. But
I'm comfortable.
When I was doing audits, that was the only one that came up so far.
There's a
Helping with
there's a couple around the county, but not too many.
Then I have to, one of the ones that struck me, and I contacted Barb about it, Wells Fargo analysis fees. This is an annual fee on our banking account at Wells Fargo, ranges from $3,000 to $4,000. An analysis fee.
Well, I think you need to talk to Sharon
Sharon.
regarding how that works. It has
Okay.
to do with the quantity of checks and transactions and things, if I recall correctly, when I saw those invoices before. But check with Sharon in
Okay.
Treasury. I think that's where I kind of directed you yesterday when you asked that question too.
Yeah, I didn't get a chance to,
Yep, no, I would
to
definitely
get
go
back,
there.
so
She'll
I
be
just,
able to explain that statement.
Probably help to get a history on that too. Is it the same every year, and what does that mean?
yeah, it was not so much the amount, well, it was the amount too, but it was the word analysis fees that kind of just didn't quite fill in the blank for me.
Yeah, yeah, Sharon would be able to
And
tell
the
you
invoice
exactly.
is really simple. The invoice does say that. I look back when you asked about it, I look back to the one in the previous year, that one that I sent you. So that Sharon would be the way you need to go.
And thank you for responding. I think I sent you 6 different items to,
All
but
the others
you-
all the others were okay. I
all,
just-
everything else was fine, yes. And remember, part of this is a learning curve.
Oh, you bet.
You know,
That's all I
Good
go.
question.
Just for
Which
the-
part? That's
Yeah.
the test.
go there, don't you, Smith, huh?
And all I need, Paul, was the actual copy of the invoice from the previous year or something, so you could see what the full description was. That's what he asked me for.
Okay.
It's good to question things like that. Good. Any additional discussion or questions? Okay, we can take a vote on approving the accounts payable, correct? Have I done that correctly? That's what's on the motion. All those in favor, say aye.
I
Opposed? Motion carries.
Update, when I was reading the minutes, I did say I was coming back today with regard to that, joint ditch 52 loan, and that did not, all come in place, so you'll be hearing from me in the next meeting in February.
Okay.
All right? Thank you.
Thank you, Barb.
Thanks, Barb. Madam Chair,
Yes,
maybe we take a time out here and.
Yeah, I waited you out this time.
Well, it's time, and, break, and then I would propose we postpone the committee updates after the closed session, if we can do that, just in sake of time.
Yes.
very good.
So do you wanna close the session now and then take the break before we go into the? And what I mean is, sorry.
I'm
And
with
the
you.
public meeting, and then you can just start the closed session after break.
Okay,
Sounds
Yes.
good to me.
sure.
Do you
What
need a
should-
motion on that, or can the chair do that?
Can
A
we,
motion would probably be best, yeah.
I'll make a motion to close the public session of the board meeting.
okay, we have a motion, do I hear a second?
Second.
Okay, we have a motion to close the public portion of our meeting. All those in favor say aye.
Aye.
Opposed? Motion carries. Shall we take a 5-minute, 4-minute? And will we resume here?
Yep.
Okay, should we say we resume at 20 past? That gives us about 4.5 minute break. All right,
Sounds good.
all
Might
right,
not be back till 5.
all right. This will be coming next week.
Andrew, and then you'll make sure that you reopen and start all over again.
All righty.
I'm stopped recording, so I'm gonna get out of this.
All right.
Log out. I don't wanna log out.
All right.
But I am going to end the stream.
Yeah, because that was, it should have been amended and a new one